Ladies and gentlemen, please welcome Anthony Calafura, student, Hunter College. Please welcome Beth Finkel, New York State Director, AARP. David R. Jones, President and CEO, Community Service Society. And please welcome the 57th Governor of the great state of New York, Governor Kathy Hochul.
They gave me a script. I'm going to be very careful to do this right. So, well, first, good morning and welcome. As you know, I'm David Jones. I'm President and CEO of the Community Service Society. We're also joined today by the Chairman of the CSS Board, Mark Willis. We're really honored to have the Governor here at this bill signing. It's, of course, we're not for CSS's signature Community Health Advocates program, known as CHA, we would not be here today. As the state's designated health insurance ombuds program, I believe the largest such program in the country, CHA has served more than 500,000 New Yorkers, saving them over $180 million since 2010. In 2019, child counselors reported a 64% spike in medical debt cases. That led CSS to issue 7, I mean a lot of reports for us, from March 2020 to April 23, documenting the nature and extent of medical debt in New York State and its devastating impact on patients. From that initial research, we launched the statewide End Medical Debt campaign, which was led by CSS Vice President Elizabeth Benjamin. She came down. She should be doing this, not me, because she led this and her staff have done extraordinary things with this program. She got COVID 2 days ago. And this should be her victory lap, but I think she's hopefully recording this, and we'll see. More than 75,000 patients have been sued by not-for-profit hospitals in the past 7 years. Our research found that those sued were disproportionately low-income people, people of color, and New Yorkers who live in rural areas of the state. And we know that medical debt that is reported to credit agencies is almost always inaccurate. On behalf of the CSS, we applaud the Governor, who has shown tremendous leadership on this and other issues of importance, having enacted 4 bills in the past 2 years, including legislation banning providers from placing liens on patients' homes and garnishing their wages in medical debt cases. Governor, we're truly grateful for your support of the Fair Medical Debt Reporting Act. It's very important, and not only to this agency, but more importantly to the constituents we're trying to serve. Once signed into law, the measure will both prohibit providers from reporting medical debt to credit bureaus and bar the credit reporting bureaus from reporting medical debt out to would-be creditors. Before I yield the podium, Governor, we have messages from much of the coalition thanking you personally. Sometimes not-for-profits, particularly advocates like us, don't thank people after they enough. But in this case, we have collected signed thank you notes for you. And these are all from part of that coalition and medical debt for taking this major move towards protecting New Yorkers. Thank you, Governor. Get out of your way.
It's actually pretty heavy.
Yes, there's a lot of cards in here.
It's a nice practice. I actually like this. Thank you, David. First of all, we are here today for one reason, not the least of which it's very close to me to come to from my office. But I'm here to say thank you. This is a season we reflect back on many of our blessings. And we are so blessed that since 1843, there's been an organization that attracts a team as well as volunteers, the Community Service Society, and just helping people overcome life's hardness and giving people a shot to say, you're going to be okay. And so I'm grateful there's people that are so selfless and so caring of their fellow brother and sister that they would be part of this organization. And of course, they are great partners with the state. When we need something done, we need to have a call center set up for people to know whether they're going to be off the Medicaid rolls because of the pandemic changes and what happened and why. We need to know that there's a place they can call and get an answer. And this is that place. So I want to give all of you a round of applause for what you do for us. And David Jones is leader and our chairman of the board and everyone else associated with, we are thankful that there's people like you who do stand up. I also do want to recognize Beth Finkel here today. When I need someone who can be the voice of people that are my age, I call on Beth Finkel, and her age too, as the director, the New York State director of AARP, which is an organization that is synonymous with fighting for people and getting them what they deserve in life and particularly as they age. And so thank you, Beth, for all you do for us. And you're going to be hearing shortly from Anthony Calafiora. Is that, get it right, Calafiora? Did I get close enough? Anthony's going to tell you a story of what it's like to be a student and have to deal with medical debt. And so these are the people that we're fighting here today. Also, we have our great leaders in our state legislature. These are their bills. I have to give credit where credit is due. They come up with them. They sometimes hold hearings. They work with their staffs. They work with the advocates. And I'm so sorry Elizabeth can't be here today. Let's give another round of applause for Elizabeth. The chair of the Health Committee, Senator Gustavo Rivera, thank you for being such a great champion. Julia Salazar, always grateful for the vision that you bring, representing not just your district, but also the people of this state. And Amy Paulin, our assigned member of both of our bill sponsors, thank you. These are the people who care so much. And Karines Reyes, a assigned member who's actually a registered nurse. So we've done a lot together because she has seen firsthand the challenges that people have. So I'm grateful to Marjorie Velasquez is also council member, chair of the Consumer Protection Committee. I want to thank her for her leadership. And of course, it's nice to have the voice of experience who served in office, I believe, 50 years, Dick Gottfried, is that accurate? 52, and a member of the CSS board, so it's great to see you. But in a couple of minutes, we're going to be signing bills that'll targeted for one reason, to lift the crushing burden of debt off our fellow New Yorkers, and it weighs them down heavily. We'll be banning opportunistic drug makers from jacking up prices to gouge prices at a time when people need some relief. We're tackling automatic renewals from hidden credit card fees that quietly siphon money out of your bank account when you're doing something else. And also the money goes from your bank account into the coffers of the big corporations because they know they can take advantage of you. And we think about taken together, all these protections will help shield New Yorkers from predatory practices. I mean, there are little people who are conspiring against your pocketbook and to help you not get a better chance in life, but to help you go further into debt. And that's what we're talking about. And the stress that this causes for people. You think about, a mother sitting in a parking lot, deciding whether she should take her child into an emergency room or not. Is she going to be able to pay for this? Is she going to be straddled with debt? I mean, the level of stress this causes. Think about an elderly citizen who's taking their prescription drugs, opens up the bottle, empties it out on the table, and cuts the pill in half to make sure it can last. I mean, this is what people are doing, not in other countries, but this is happening in America today. And that's what we're fighting here against. And we have actually 340,000 New Yorkers who are struggling with medical debt right now. That's larger than the entire population of my hometown and on the other side of the state. I mean, that's how many people there are that are dealing with this every single day. Medical debt is such a vicious cycle. It truly hits low-income earners, but it forces them to stay low-income earners because they can never get out from under it. And that's what we're talking about. And it starts unexpectedly. No one thinks, I think I want to get sick this year and run into debt. I'm going to need major surgery to stay. No one thinks like that. It happens to everybody. But if you've got money in your bank account, you're going to be okay. If you have a really good insurance program that doesn't ask a lot of questions and covers everything out out of network service as well, you're okay. But so many New Yorkers don't have that luxury. They don't have that. And to me, that's just a basic human right to have the ability to get health care without sliding into crushing debt. And so that's what we're talking about. No one plans to go to an emergency room. No one plans to break a leg. I broke a few ribs and 2 wrists my first year as lieutenant governor. I didn't plan for that. I walked around with a cast on for a long time, or a chronic illness. Like I said, the copays can sometimes be so much as well. So hospitals sometimes will offer you a medical credit card. Oh, that sounds nice, a nice credit card from the hospital. The people are taking care of me, but the payments are so high. And pretty soon, unbeknownst to you, you fall into debt and you have a black mark on your credit report. So that's when you start spiraling. Prospective landlords aren't going to call you back when they see that, right? You're trying to be able to rent a place, maybe a little bigger place if you got a family. The bank won't give you a car loan if you don't live close enough to public transportation. You want to get a cell phone? Cell phone companies are looking at your debt, and they can turn you away as well. Even a prospective employer, you want to get a new job, but you're in debt. Like, I didn't know I was in such debt. I didn't know this illness was going to happen. I didn't know this would, be on my mark on my life forever. So it's really, really hard for people. And what I want to do is talk about how we get them out of it, because it's wrong on so many levels. In your credit score, we talk about medical debt and some of the practices of unscrupulous businesses. Your credit score is supposed to measure how responsible you are with your money. It's sort of a arbitrary way, but they'll say, well, if you have a good credit score, that means you manage your money well, that will let you take out loans. But it's not based on adjusting for life's realities. It wasn't mismanagement or a character flaw that brought you to this place. It's just expenses you didn't count on in life. How could you have budgeted for something that's unforeseen? So that's what we're talking about, how to get out from under that debt. And it can happen to any of us. But again, as I said, some of us have an easier chance of getting out of it. And debt collectors know you're afraid of them. They know you're afraid. And they will haunt you. They will stalk you. They'll call you in the middle of the night. They'll sometimes see you in a public place. They're out there to get you. And that is just adding more misery to existing misery. And that's all-consuming, and it's frightening for people. And sometimes they just strong-arm you. And I want to correct that system, a system that preys on people who are in pain and in desperate need of care. So I'm signing a bill that bans hospitals, healthcare providers, and ambulance from reporting medical debt to your credit agencies. Let's take that right off. That will not be factored in there. That's going to be, people can focus on getting healthier and not focus on whether or not someone's going to catch you and trap you and make you spiral even more so. That's what we're talking about. We're just the second state of the nation to do this. I'm proud of that. New York leads, the others will follow. So this is an extraordinary opportunity, and it builds on a bill I signed last year that prevents hospitals and nursing homes from putting liens on your homes. Can you imagine that? And thank you. Thank you for the leadership of getting that through as well, the legislature, our senators and assembly members. And garnishing, they used to garnish your wages over medical debt. Again, think about this scenario. You were sick, you lost time off work, you may or may not get back, so you don't have the source of income, you run into debt, and then how do you get out from under it? Oh, by the way, they're also going to garnish your wages. That's a big word for saying we're taking your money, okay? They're taking your money. So how are you going to get ahead? And when you think about the crushing debt on people, it's college loans, it's credit card debt, and also medical debt as well. And also, let's talk about those opportunistic drug suppliers. Oh, they are something else. You're laughing because you've seen what they would do. And they'll manipulate and overcharge customers for medicine, especially when there's a shortage. That's about as low as it gets, in my opinion. I mean, people stay alive because of these drugs that are available. But all of a sudden, a lot of people want them, so there's a shortage. So instead of going and making more, let's just charge more for what we have so we can bring in the same profits and not really care about the people that are saying, what do you mean it costs that much? A year ago it cost this, and now it costs this much more. We're just stressing out people all the time here. Come on, let's give everybody a break. And, Big Pharma might call that the invisible hand of the free market, where they can do what they have to do. We have 2 other words for it. We call it price gouging. That is price gouging here in the state of New York. And I'm signing a bill today that bans the sale of medicine at unconscionably excessive prices during a drug shortage, as defined by the FDA. So there's a shortage. There's a shortage, you're saying there's a shortage? Okay, but you can't jack up the prices because you're hurting the people that we're fighting for every single day. Two other bills I'll be signing today plug in key consumer protection gaps. They're not as egregious as the medical debt, but over time, it just keeps adding up and up. And they found out, a study that was done by Chase Bank found that 71% of Americans waste over $50 a month on unwanted subscription fees that you may have signed up for, may have been a promotion. Say, oh, for $1 a year, you can get this subscription, and all of a sudden you're paying $300 a year after that. I mean, it happens all the time. It happens to everyone. And 2/3 forget a recurring payment. Well, guess what? They're going to debt as well. We've seen it. You see that random charge on your credit card? Who has time to take a half a day off work? Because I've tried this, to try and call somebody to get the bill taken off, because I don't even remember signing up for that. You know, maybe I wanted to watch a Disney Plus for a day to watch Hamilton when it first came out. I don't want to watch Disney Plus anymore. I mean, they're great people, great shows. Maybe when my granddaughter gets older, but I'm not using it right now, and I'm still paying for Disney Plus because I don't know how to stop it. No offense to Disney Plus. It's a great program, and Hamilton was fabulous, but a lot of people are in that situation. It takes a lot of time and effort to say, I'm done with this, or it was supposed to be a trial period. I want the trial to end, but they make it so hard, right? It's intentionally designed to be hard so the money keeps going to them and out of your pockets. So the automatic renewal has to stop. They have to notify you, we're saying. Okay, well, how about letting people know before it, when it's a 10-day free trial, and all of a sudden you're paying $51 for 3 months, and then it keeps going up, and then an automatic renewal is now $73 a month. I mean, this is YouTube TV I'm talking about. This is real. So the tech giants, we love what they do. We want them to change their practices. Okay, we're happy they're here. Be prosperous. Give us more content. It's great. Give us more subscriptions, more shows to watch. But I think ultimately people are counting on you to lose track and to forget about it. And that's built into the business model. And they make it intentionally hard to cancel. So look at what everyone did during the pandemic. The streaming services kept you connected to people. You had something to talk about. Did you see the latest episode of Mrs. Maisel? I did. I saw them all. So it was something to talk about, right? It was a human connection. You're watching all the shows, and Ted Lasso, and I'm not going to go down that path. But this is what's happening to New Yorkers. The people we're here to protect. And so we're going to make sure that we're signing a law today that requires businesses to notify consumers of any upcoming automatic renewal or continuous service charge. At least let people know in clear language, simple, push here to cancel. Let's make it simple for people because life is hard enough. And also, they have to have very clear instructions on how to cancel anything. The last bill I'm signing today will address invisible credit card fees that drive up the cost of goods and services. Invisible for a reason, right? Business model based on this. More businesses have begun charging customers extra when they swipe their credit card. Who knew this? Does anybody know this? I mean, basically, we are a credit card society. People don't walk around with cash. People have no idea what this green stuff is. It's from a long time ago. So it's PayPal. There's other ways to do it. But if you have a credit card, you don't even know that they're charging you extra fees to use it. And it's buried as a surcharge, a service fee, a convenience fee. Or they just skip it and supposedly give discounts. People pay with cash, except no one uses cash. So let's make them be transparent. Let us know what you're doing. Let's have the true price up front when you're making your decisions. And that's what this new law will ensure as well. So every cent counts for people. When you're living on the edge, every penny counts. And we're talking about today can help you, whether you find yourself in medical debt, whether you're a senior citizen like my father used to sign up for everything, and now that he's gone, we're seeing his credit card. Like, Dad, you didn't even watch these services. So it happens to people unknowingly. It all adds up, and it can send families into ruin. I don't want to hear any more about families making these tough decisions. Let's just give people a break, and especially our seniors who are so vulnerable. They are intentionally preyed upon, by these services, by the drug manufacturers who take advantage of them, and no one should ever have to make a horrible choice between their physical health and their financial health. So today, we're making a difference, and I want to thank everybody who had a role in this, all the advocates who got the job done, got this over the finish line. I want to applaud all of you. Thank you, everybody, for being part of helping make history here in the state of New York. With that, it's my pleasure to introduce a leader who is at the forefront of ensuring that New York State is recognized and has the policies to back it up to be one of the most age-friendly places in America. We've made many announcements together. That is the New York State AARP Director, Beth Finkel. Beth?
Thank you so much. I was actually going to lead off about what a great leader you've been to make New York State an age-friendly state, and here is more examples of your continued efforts to do that, and AARP is so appreciative of that. So we also want to thank you so much for signing this law into legislation that's so vital for New Yorkers, especially older people. As you said before, they're living on a fixed income, and it's so much harder when they rack up debt. And so this is a great protection for them. Reporting medical debt to credit agencies can really further hobble people's abilities to be able to get loans, to get mortgages, to be able to keep their head above water, as you stated also. And so we cannot thank you enough. Prohibiting such reporting will make it so much easier for New York State's rapidly growing population. Just in the years 2011 to 2021, by the way, the 65-plus population of New York went up 31% in just those 10 years. So paying attention, being so sympathetic and understanding the issues and really confronting them and taking over them and making sure that they're not there for older adults is so incredibly important. And this new law will also go a very long way to help older Black and Hispanic older adults because they face a much higher debt burden. So again, thank you, Governor Hochul, along with the bill sponsors, Senator Gustavo Rivera, who's also always been a great champion for older adults, and Assemblymember Amy Paulin, also always there. And I just want to say that price gouging one means so much to AARP. Affordable drugs is one of the #1 issues that we work across all of New York State. And now here we are again, New York State leading the way. So thank you so much. And thank you to the legislators. This is just amazing. Thank you. And I get to introduce Anthony Calafiora, I hope I said it right, who's going to tell you his story. So thank you, Anthony.
Hi everyone, my name is Anthony Calafiora and I am a student at Hunter College and a member of NYPIRG. When I was 17, I was hospitalized for 2 weeks, and even though I have health insurance from both my parents, I was still forced to take on a significant amount of medical debt. I have dealt with the consequences by myself ever since, and there was just no way I could pay it all off. The debt was sold to a collections agency, and I have received many phone calls and letters which were extremely stressful and detrimental to my mental health. The passage of the Fair Medical Debt Reporting Act will ensure that my credit report and credit score are not affected by the debt. It will ensure that a medical emergency will not affect the rest of my life. I want to thank Governor Hochul, Senator Rivera, and Assemblymember Paulin, as well as the End Medical Debt Campaign for their leadership in getting this bill passed and signed. I look forward to contributing to this work and ending medical debt for all New Yorkers. Thank you.
Please remain seated for photos. The bill signing.
This way? Oh, please. I'm totally. Huh?
still collecting pens for me.
Yes, I've got quite a collection.
All the bills are listed on this.
Got it, stay seated. Thanks, folks. Bill in the front.
Never knew. We did it like this, David? You literally do sign bills. All right. The bills are signed into law.